FAQ breast augmentation. Do breast implants have to be changed every 10 years? No, they do not. The newer generation of breast implants, which is the 4th generation of breast implants, do not have to be changed unless they're having a problem. So the risk of having to have your implant replaced is 1% per year. So if you have your implants in at age 30 and you're gonna live to age 80, there's about a 50% chance in your lifetime that you'll have to switch out your implants. Can you breastfeed with breast implants in? Absolutely. The breast implants typically go underneath the muscle, which is in a separate pocket than the breast tissue itself. So there's no reason that a woman with breast implants couldn't breastfeed. The silicone breast implant is completely separate from the pocket where the milk is made. So there's no risk of like silicone getting into the milk or anything like that. How fast is the recovery for breast augmentation? Fast. Most people will be very surprised at how quickly they feel pretty good. Most people feel pretty good after about 2 or 3 days and are able to go back to doing most things, including work and light exercise. Patients often ask when they will have their final result from breast augmentation, because when you first put breast implants in, they can sometimes look like they're sitting in your neck. Breast implants take 4 to 12 weeks to drop into position, so it takes between 1 and 3 months to get to your final result.